You're listening to the AOD Disability Employment Technical Assistance Center podcast, where we learn from people who are working to improve competitive integrated employment and economic outcomes for people with disabilities. In today's episode, we talk with Nicole LeBlanc, DETAC's self-advocate advisor, about the consequences of the COVID-19 pandemic for people with disabilities. Mostly detrimental in terms of increased risk and unemployment, but also some changes that have benefited people with disabilities, such as remote work and telehealth.
Nicole, introduce yourself for our listeners.
My name's Nicole LeBlanc. I live in Silver Spring. I wear a gazillion hats. I serve as the self-advocate advisor, the Disability Employment TA Center. I've been in the disability field since October 2007. I'm originally from Vermont.
And how did you get into the disability field?
Well, I discovered the self-advocacy movement in Green Mountain Self-Advocates back when I lived in Vermont, when I was transitioning into the shared living provider and getting developmental services. And I discovered that the self-advocacy movement was one of the best kept secrets in Vermont. And it's like, prior to the self-advocacy movement, I'm somebody who always wished to be normal. I was always teased, picked on. I was always like the odd, weird kid, the outcast who could never fit in socially.
And then how did you end up coming to Washington, D.C.?
Well, I discovered, first time I stepped foot in the nation's capital was 2009 Disability Policy Seminar, where I met Kareem Dale, Lois Curtis, Sarah Peterson. And I was like, wow, now this is a place I could see myself as somebody who's always been following politics. It's Bill Clinton's sex scandal. Somebody who's always wanted to be a change agent.
So you're one of the most opinionated people on the issue of COVID I know. Tell me what your feelings overall about the COVID and the pandemic are.
The disaster that didn't have to be this bad. Especially given that, Bill Gates has warned about the threat of a pandemic since 2014. It's like, from day one, if we had, we had just told everybody wear N95s, and invest in cleaning air. And most recently, studies have come out showing that people with autism and neurodiverse populations are at high risk of long COVID. An autistic doctor in Vermont opened up a practice just focused on neurodiverse populations, all because she was seeing, a massive wave of long COVID in the autism and neurodiverse population. Because people with autism often have an overreactive immune system.
So you're you're in probably like the 95th percentile of most cautious around COVID people I know. Tell me what your personal thinking on the issue is.
Well, until this becomes a common code, masking is the new normal. If everybody would just, and if we would spend and focus on cleaning the air, that would help. And for me personally, just doubling up wearing, and then it makes me less anxious.
I just was talking with someone else here in the office, and we were talking about when we mask and when we don't mask. There's places where I obviously always wear a mask, like on the subway. Sometimes I don't wear a mask when I go into the grocery store. I mean, I do most of the time. But at this point, I feel like I don't know what to do. I feel like there's no guidance. Yeah. Everybody's been cast loose. It's figured out for yourself. I mean, I still I don't do any, to this day, I still don't do any optional activities. I don't go to restaurants. I don't go to bars. I'm not going to a public place still, especially not right now with a whole new
and
the middle of
flu
winter
season and having flu on top of it.
Yeah.
It's because when you look back, at this beginning where you saw, flu cases and norovirus going, if anything, this is shown is that, having bad flu seasons doesn't have to be the norm if we, buck up and make sacrifices like masking, hand washing. The same way we stop stomach flu is the same way we stop this pandemic. Stomach flu is a super spreader, just like COVID. And it can be stomach flu, just like COVID can be spread asymptomatically. Another comparison, how many of us grew up in the 90s, lived with people who smoked cigarettes? In the 90s, it was common for children to get massive gazillion ear infections every single year due to secondhand smoke being exposed to it in an indoor setting. As soon as my parents, all my uncles, everybody stopped smoking, people like me stopped getting a million chronic ear infections, which all those antibiotics, even though they're getting rid of the chronic ear infection, they're now causing colon cancer, which is why colon cancer screening is 45. It's like it's airborne. Cigarette smoke is airborne. We need to look at these COVID mitigation measures as just like airport security. What do we do when we go to the airport? We take off our shoes, go through all that, and put up with pat downs. Much as we hate being patted down a million times, we just suck it up and do it. It's why we, show up 2 hours prior to flight. It's no different than airport security.
What is your own sense of what we should be doing right now? And
right now, everybody should be, keep doing, hand washing and masking, and we should be spending billions of dollars. Stop spending money on war and spend money on cleaning the air. This is airborne. It circulates in the air. Even after somebody leaves the room, their germs are still in the air. That's the thing. The World Health Organization, everybody needs to say this is airborne. And we need to make vaccines. Hopefully, there's talk of nasal vaccines that can go through the nose that block infections. Until we get something like that can block infections, get rid of the threat of long COVID, make this just become just another common cold where, take the Alka-Seltzer plus zinc, vitamin C, and all that, Vicks Vapor, until we get to the point where it's just a regular cold with no long-term complications like Crohn's disease, gut dysbiosis, and all that. Until we're not hearing about long COVID, it ain't going to be in the rearview mirror. When we stop hearing about all these complications, people having strokes. I know one person, a therapist who also has autism, she caught COVID twice and she had a mini stroke. These mitigation measures, they not only protect you, but they protect the immune compromised, the highest risk populations. When the high risk populations are protected, everybody wins. Health is the real wealth, not silver and gold, as Gandhi would say.
So let's talk about the economic impact of COVID. Tell me how it's affected the employment of people with disabilities.
Well, in the beginning, it led to, massive job loss, especially for essential workers and people at high risk, needing to get unemployment insurance. One big plus was all the extra unemployment bonus bump, along with stimulus checks, which, personally, I say, we should be doing stimulus checks, ongoing every month. We should move to universal basic income. Plus, it would also help mitigate the loss of income when it comes to needing to quarantine and all that. And we need to adopt paid sick leave in this country. Right now, the CDC should not be telling people, oh, 5 days quarantine, 5 days, you can go back, but 5 days mask. It should be complete 14 days, go back when you test negative. And when it comes to, planning for disasters, like responding at, in the beginning, you should say upfront, we need to play the better safe and sorry mentality until we figure out how this whatever spreads, which you look back when we were doing all surfaces and all that. And then all of a sudden now we more clear that this is airborne.
So tell us specifically how it's impacted people with disabilities. And like something you've talked about is how, because people with disabilities are overrepresented in the essential workers field, it's really impacted them a lot more than other people.
It's led to, just many people just work in food, filth, flowers, and while the hazard pay and stuff like that is nice, in addition, many people had to stop working in the beginning due to their risk factors. So that unemployment bump in payments definitely helped.
And how is it
in
affected?
addition, the stimulus checks, also generally speaking, gave, peace of mind. They enabled us to, absorb the cost of this pandemic universe of, buying technology, buying N95 masks and other work from home equipment.
And how has it affected people with disabilities via the way it's affected people with disabilities support staff?
In the support staff, we've had lots of staff turnover. One think it's nice that the Appendix K flexibilities, allowed a certain bunch of, bureaucracy to, you could say, be waived, which, if there's any one thing, when we look at the new normal, Appendix K should be become standard part of the new normal, and having, hybrid, having virtual options for everything, conferences, making telehealth accessible, not insisting on, oh, everybody show up at the office 5 days a week. Many people with disabilities prior to this pandemic were denied work from home as an accommodation. Telehealth is also good. It's convenient. It saves the cost of transit, wasting time sitting in traffic, especially if all you're going to do is, oh, these are your blood test results. These are your labs. Your B12 is low. Your vitamin D is low. For instance, somebody who gets regular blood work. Telehealth allows you to do nutrition appointments. I just had a nutrition appointment this morning with my nutritionist. And tomorrow I have one appointment with my naturopath, which will all be virtual. Click on a link. No need to run around. Big thing with telehealth is, we still need work on making platforms easier, more accessible, especially when we look at the older generation that isn't as tech savvy. When we make everything accessible, plain language, everybody wins, regardless disability or not. Keep it short, sweet, simple, to the point.
This is sort of a reiteration of the previous question, but what practices that have come about from pandemic and our response should be preserved to enhance accessibility?
Well, preserving, Appendix A, telehealth, remote therapy, having all college classes, have a virtual component, not just a face-to-face component. Have everything, hybrid between business, work, conferences, events, healthcare. We should bring back Dr. House calls. Like if we look at, that's one thing that could help right now with making vaccine access more accessible to people. In the beginning here, when the vaccines first came out, the vaccine website to go get a vaccine or register for at a clinic was not very accessible. First, I called my primary care doctor. They say, oh, go call 211 or 311, Montgomery 311, and then call that and to get the runaround. Finally, I asked somebody I know at Seek, which is an agency right down the street from me, and they're like, here, fill out this paperwork. We'll take you. We'll take care of you. Yes, vaccine access needs to be accessible. I even sat on, Zoom calls, all on in a Facebook group, all on figuring out how to get people with disabilities vaccine access and brainstorm figuring out. And one thing, all pharmacies and all doctors should have all vaccines, whether it be Pfizer, Moderna, or whatever. It's like, you didn't have to go through all these hoops when we do flu vaccine. I can just walk into Walgreens here, fill out the paperwork, there's your shot, and that's that. Keep it short, sweet, simple, to the point.
What should grantees know about how they can support their remote staff?
Well, provide job coaching, provide natural supports. Many people with disabilities, especially autism, who don't have intellectual disability like me, do not get any HCBS supports. Voc rehab is only provide short-term 90 days and then you're on your own. Having what's using Google Docs, using, accessible, meeting platforms, providing, help with covering cost of certain things, work from home stuff, doing check-ins, not holding, when it comes to setting up meetings, not holding back to back to back to back Zoom meetings without giving people a break to breathe. One downside when we look at before this pandemic, after, with everything, a lot of meetings being virtual is you're not given that 5 minutes to breathe between meetings. Whereas when we were all face to face, we had at least 5-10 minutes to breathe, run off to here, run off to there. And quite often you've seen people, in the beginning, they were working more than 40 hours or whatever their regular schedule was, and just jamming stuff in addition, things like, having multiple turnover supervisors and all that can lead to burnout. Somebody who used to work for state government, who left state government in 2020 due to burnout.
How have people with disabilities been taking advantage of the new options for teleworking and other remote access?
It's led to, increased employment opportunities. Many people with disabilities, right now say, we should not be rushing people back to an office. We're not endemic, first of all. And the new normal needs to be flexible. The new normal needs to include the needs of the disability community. We do not want to return to a normal that excludes us. Flexibility and control is essential. In addition, we should look at moving as a society, move to a shorter work week, which will help reduce burnout, make every Friday, let's say, a mental health day, which will help cut down on the burnout, Zoom fatigue, focus on, a New Year's resolution, focus on slowing down, live in the moment. When we look at our culture, so much is hustle, 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 jam, jam, jam. Whereas you look at countries like Iceland, it's so paced, laid back, focused on living in the present. In addition here, we should have a loose dress code. That's, I'd say, been the best thing, is not having to always adhere to a conservative dress code. As somebody who comes from Vermont, who prefers laid back, I'm not, the person who's like big on suits and all that. A laid back dress code is essential in the new normal.
Tell us about the trauma that many of the especially vulnerable people have felt as a result of the rest of the population going back to normal.
Well, it makes people never scared because long COVID is still a threat that people, the general public, and our government continue to downplay. From day one, we've all said this was going to be a mass disabling event. We need to approach this pandemic as if it's act like it's cancer. Cancer was spreading like this. Would we be downplaying it? No. Yeah, every time, if we were approaching this as cancer, we wouldn't be acting this way, because when you hear the word cancer, the C word feels like a punch in the gut. And it just makes everything stop. Your world stop every time you pick up the phone and hear somebody say that word. We've seen health disparities. Many people just were denied ventilators, denied the ability to have staff come to them if they have to go to the ER, the hospital, which is, many of us here, also have difficulty, communicating events, Like, for instance, here, on March 13th, I ended up going to the ER in what was determined to be a panic anxiety attack. I woke up on the 13th having chest pain, sweating, which prior to this here, I've never had a panic attack in my life. And if anything, this pandemic has given the whole world a simulation of what it's like to be disabled. When you look at ADD, it's raised, anxiety levels, it's raised, concentration levels, and we look at the Great Resignation, one thing that led to the Great Resignation is people are tired of burnout, people are tired of not having control, and, authoritarian type management styles are not going to cut it going forward. You need to focus on, if you take care of your workers, meet their needs, then you'll have a better bottom line. It's time to put people before profit. Health is the real wealth, not silver and gold. You don't know how good you have it till it's gone. We take, this pandemic has exposed how much we take for granted.
How has increased flexibility in employment benefited people with disabilities?
Well, it's led to, more people with disabilities getting jobs. It's definitely increased, and we look at the worker shortage here has helped, which right now, if we really truly want to address the worker shortage, one thing that would be smart is to get rid of the benefit cliffs and SSDI, where the all or nothing cash cliff, and get rid of asset limits and earnings caps, SSI, SSDI, expand Medicaid buy-in. Doing that would help long-term in solving the workforce crisis. And then the DSP shortage, the direct care, we need to stop paying direct support providers lousy wages. You make more in an institution, working in an institution than you do in an HCBS setting, which isn't fair. And then, of course, if you self-direct, one advantage is that not only can it, possibly reduce, COVID risk exposure compared to being in segregated settings where the risk of COVID is off the charts. By doing self-directed services, it also allows you to put in measures to reduce risk and pay your staff a higher wage. So instead of paying somebody, let's say 15, you could maybe pay somebody, 20 something and take less hours. Like, for instance, agencies in Vermont, I know, that are allowing people to be more flexible with taking less hours and paying more. No staffing crisis, yet people that are keeping wages at 15 or whatever are still struggling. Everybody in this country deserves a livable wage. We must get rid of some minimum wage. It's time that we start treating our caregivers with respect. And it's time that we start supporting families. Many families talk about how they feel forgotten. They feel like they've been, They feel disposable. I know one mother in Vermont who developed long COVID from the Delta variant when she and her son with autism who uses FC or supported typing caught it back in 2021. And it's like she has struggled massively to deal with getting support for her son so that she can focus on healing. And paid sick leave needs to be mandatory and paid leave in general. The era of going to work with a cold is over. It's time for common sense solutions to fight our nation's gravest challenges. And it's time to get comfortable with being uncomfortable and build and foster resilience. We must use this crisis and use it to prevent the next one. It's time to, do the dirty work and let's make this the last pandemic we ever have to deal with.
Nicole, thank you for talking to us today about an issue I know is very important to you.
Well,
What do you
thank
think?
you for having us, listening to us today and joining us on this program. We look forward to seeing you in a future episode.
You've been listening to the AOD Disability Employment Technical Assistance Center podcast. Today we spoke with Nicole LeBlanc, DETAC's self-advocate advisor. The AOD Disability Employment Technical Assistance Center, or DETAC, is a project of the Lewin Group and TASH, created by a grant from the Administration for Community Living to provide evidence-based training and technical assistance to Administration on Disabilities grantees aimed at improving competitive integrated employment and economic outcomes for individuals with disabilities across the nation. To learn more about DETAC, visit aoddisabilityemploymenttacenter.com. For news and alerts about upcoming webinars and podcasts, you can follow us on Facebook and Twitter. Music for the DETAC podcast is an original composition and performance by Sunny Sefarati, the co-director and autistic self-advocacy mentor at The Musical Autist. You can learn more about The Musical Autist at www.themusicalautist.org. We'll have another episode on competitive integrated employment for you in the near future.